Hi guys, Peter Dingle here, just at Qantas Airport. We've just finished our Queensland tour, 12 talks, 12 presentations in everywhere around northern Queensland down to Brisbane and so on in 16 days. So great to be heading home. But I'm at the airport, so I thought what a great time to talk about health when we're flying, because most people don't realise the implications. Now, one of the biggest things about flying is that literally, because of the changes in pressure, you increase your risk of deep vein thrombosis. Now, a lot of people probably don't really know much about it and think, well, that's pretty rare. Right? So a study a couple of years ago demonstrated that about 1 in 8 people over the age of 50 have what's called a subclinical deep vein thrombosis. So they've actually had the thrombosis, the clots occurring, but they didn't notice it, they didn't detect it, they didn't go to the doctor and the doctor didn't detect it. So the issue is really clear. A lot of people are affected and they don't realise it, and it may have implications for health later on down the line. So if you're a frequent flyer, like we are when we go into our talks around the place, it's really important to consider it. And I would suggest two really important things. And first is drink lots of liquids, and not alcohol, lots of other liquids in there. Even teas, lots and lots of water. Just make sure you keep doing that. But even more importantly is exercise your leg muscles. Now, it's really simple. All you need to do is get up out of the seat, walk around, go to the toilet. They might think you've got a weak bladder or so on. It doesn't matter. Just go for a walk. You've got to walk at least every hour. Now, we already know in the studies on sedentary people in office buildings and so on, that they too can have deep vein thrombosis. But you're talking about because there are no pressure changes when you're in the average office. You're not going to get it as frequent, but we know it occurs in those circumstances. So here, flying with the pressure differences, you really need to get up. The recommendation back in the office again is to get up every hour and go for a 5-minute walk. You need to do the same in the plane. Even better is just get up and down out of the seat a few times so that those big muscles in your legs, the biggest in the body, start to actually push the circulation around your body, and with the drinking of the water you reduce your risk dramatically. Now, another phenomenon a lot of people probably don't realise is that when you're flying, the humidity up about 1 kilometre high where you're flying is about 10%. So it's very, very low. Years ago, in fact decades ago, I used to take my monitoring devices onto the planes. Now I don't think they'd allow me to have it because it looks a bit sus. But I used to measure the particulate matter, the microscopic dust in the air, the temperature and the humidity. Now the temperature was kept comfortably, obviously, but the humidity would drop to about 10%. Now the problem with that is first of all that you're obviously going to dehydrate. So constantly drink liquids. And why you do that is because when you've actually dehydrated from your throat and your esophagus and so on, you're actually much more vulnerable to eye, nose, throat infections. Hence, how many times have you said, I caught that bug, I got that flu on the plane, there was a guy coughing behind me. Well, yes, he may have been coughing, and yes, the air gets circulated. There is no doubt the air gets circulated because they don't want to have to keep putting water into the air and so on. So they keep circulating the air. There is no doubt about it. But the trick is, if you keep hydrated, your mucous membranes, which are your first line of defense in your mouth and nose and so on, are going to protect you. But if you get dehydrated, then you are much more vulnerable to any form of infection. And the guy behind you who's coughing, those bugs that would normally land on a healthy, moist throat with your mucous membrane saying, wow, and you'd send off an immune reaction and protect it and so on, now that can't even occur because you're so literally dehydrated. So a couple of really, really simple hints, and I know they tell you this, but I want to just reiterate why, give you a little bit of the science behind it. Get up, stand, use those leg muscles a couple of times every hour. You've got a long flight, we've got 4 hours now, so I'll be up and out to that toilet 4 times, and I guarantee it's not necessarily just to go to the toilet, it's to get the exercise, and I'll be having lots and lots of liquids, some green tea, water, and before I go onto the plane I actually take some antioxidants as well. So more on that later. I hope you like this. We're heading home to Fremantle. I'm looking forward to getting home. Take care.